Keep your cat's insulin in the refrigerator. Sometimes insulin settles along the bottom of the bottle, forming a layer of white crystals. These crystals must be resuspended before drawing up the insulin dose. Roll the bottle back and forth between the palms of your hands until all the crystals disappear. Never shake the bottle, however, as this may create foam, making it hard to draw up an accurate dose. Disinfect the top of the bottle with alcohol using a cotton ball. Allow the alcohol to air dry while you remove the protective caps from the needle. To maintain sterility, do not allow anything to come into contact with the needle before giving the injection. Invert the bottle and insert the needle into the rubber top. Pull back the plunger and draw the desired amount of insulin into the syringe. If you withdraw too much, simply inject some of the insulin back into the bottle. Avoid air bubbles in the barrel of the syringe. Even small bubbles will affect the accuracy of your dosage. If you see any bubbles, gently tap the side of the syringe to drive them to the top and inject them back into the bottle. Confirm that you have the proper amount of insulin in the syringe. Remember, insulin is extremely potent, so you must give the exact amount of insulin prescribed to your cat. It's a good idea to feed your cat before giving the injection. This serves two purposes. Associating the injection with feeding makes your cat more cooperative. And if your cat eats first, he is less likely to experience hypoglycemia or low blood sugar. There are many ways to restrain your cat for an insulin injection. You can use a tabletop, the corner of the room, or you can work with your cat in your lap. With practice, you can usually give injections on your own. But when you're first starting out, you may find it easier to have a helper.
If you've never done anything like that before, I would say having somebody near you maybe who has, so that you can feel a little more confident in it the first few times. The first few times I had somebody with me every time, which was really great.
Have your helper place your cat on the table with his head facing forward. Have them grasp each front limb at the elbows and pull the cat close to their body. Gently pinch the skin and pull upward to create a skin tent. Insert the needle down into the tent. Avoid sticking the needle across the skin tent, as it can inadvertently go in one side and out the other. Push the needle all the way up to the hub. This will get the insulin into the pocket just beneath the skin, where it will be absorbed properly. Pull back on the plunger and look for blood in the syringe. Blood indicates that a blood vessel has been penetrated. This is not serious. Withdraw the needle and try again in another location. If you don't see any blood, press the plunger and give the insulin. Needles and syringes are not reusable. However, medical waste must never be thrown into your regular garbage. Collect them in a container like a coffee can and take them to your veterinarian for safe disposal. Since insulin injections are given daily, you should rotate the injection site. This will help to minimize inflammatory reactions which can lead to poor insulin absorption. The best place to give injections is over the side of the chest and abdomen. Insulin injections are well tolerated by most cats, and with a little practice, you and your cat will soon settle into the new routine.